Here's your host for this morning's edition of America's Fabric.
Good morning. I am Dr. Elizabeth Lee Valite. I'm an independent physician in private practice in Tucson and Dallas, and the author of several health books for consumers. My medical website is www.herplace.com. Today I explore how the 2010 healthcare law undermines our American tradition of economic freedom and the liberty for each of us to have self-determination in the way we live our lives, how we choose to earn a living, the way we spend our money, how we share our wealth with others, how we worship or choose not to worship, as well as when, where, and with whom we seek medical treatment. These are our founders' core beliefs, making up the threads that have woven the fabric of America and makes our country unique in the entire world. In June 2012, the Supreme Court upheld the constitutionality of the 2010 healthcare law, primarily under Congress's power to tax us. As one of its mandates, the 2010 healthcare law requires all 50 states to either set up new bureaucracies called health insurance exchanges or else submit to being controlled by the Federal Health Insurance Exchange. State policymakers will soon have to make some big decisions about how to respond to the health care law signed into law by President Obama on March 23, 2010. The fact that the most significant provision of ObamaCare do not begin to take effect until 2014 means that the titanic battle over America's health system has not reached a definitive conclusion, but has shifted into a new and even more confusing and prolonged phase. This means you, as patients, have to really be active, informed, and vigilant to protect your medical freedom. People are confused about just what is meant by these health insurance exchanges and what it means for individual choice of medical insurance policies, as well as what those policies will cost and what they will cover. I have a guest with me this morning who will help explain this complex subject. Senator Frank Antinori has been very involved in helping develop programs for Arizona citizens that remain true to our founders' vision for self-determination and our individual liberty to spend our own money free of government mandates or control. Senator Antinori has also a unique component of his background. In addition to being a special forces operative for the United States military, he has also served in New York as a paramedic. So he has a unique perspective on the medical needs of his constituents. But before I turn to Senator Antinori, I'd like to make a few brief comments as a physician about what the health insurance exchanges mean for patients. This required program of the new healthcare law has been called an exchange because that word is so benign and sounds non-threatening. In our minds, we typically think of an exchange as a process of trading something for another item of similar value. But in this new bureaucracy that states are required to set up under the healthcare law, exchange means something else entirely. Think of the health insurance exchange is how the federal government is requiring you to exchange your freedom for government control. In the past, you have been free to choose your medical insurance policy, what type of coverage you need, and how much you want to spend on it, either from a selection offered by your employer or individual policies you purchase on your own. Under the new exchanges, you now have government, state or federal, dictating what policies you will be allowed to choose from, what they will cost, and what they are required to cover, whether you need the required coverage or not. Basically, the health insurance exchange refers to those health insurance companies approved by the state or federal government to offer health insurance policies in your state, if they meet the required coverage mandated under the new health care law. But in practical terms, what this new bureaucracy means for patients is simple. Think of the exchanges as HMOs on steroids. If you didn't like the managed care of the 80s and 90s, these new programs are even more intrusive with regard to your personal choices for medical insurance and the types of treatment that will be allowed. Let's hear what our state senator and expert on the Arizona situation has to say about all this. Senator Antinori, welcome to our show this morning. You have recently spoken publicly about your opposition to the health insurance exchanges, so I'd like to ask you to explain how you see this new government program conflicts with the core values on which America was founded.
Oh, first of all, thanks for having me on, Dr. Lee. I appreciate being here today to talk about this very important subject and how it affects people's health. Well, in Arizona, we're sort of unique because a few years ago we passed Proposition 106 that was approved overwhelmingly. Almost 2/3 of the voters in the state of Arizona said that they support having the right to choose and make their own medical decisions and not allow the government to get in the way of those decisions. So it is a constitutional right in the state of Arizona for people to be able to make their own medical decisions. And this exchange system that's being brought down by the federal laws with the new Health Care Act basically interferes with that right. And it's a very important thing to remember. And you so eloquently stated, you're exchanging something, all right. And that something you're exchanging is your freedom to choose. And, you hear the other components out there that talk about, you have a right to choose this, right to choose that. But in this one case, they seem to think that, well, it doesn't apply to this circumstance. So the exchanges, even though they may sound somewhat sort of harmless in regards, they actually are a very significant interference with your individual freedom and liberty. So that's why I've and several other members of the Arizona legislature have taken a stand of opposing them.
Well, and what would you suggest that people who are concerned about this, two questions. First of all, what options do you see for Arizona, as I understand it from the passage of the health care law and the Supreme Court ruling? The states are given the mandate or requirement to either set up their own exchange or participate in the federally controlled exchange. Is there another way?
Well, yes. If you talk to most people, they basically tell you have two choices of poison. You drink your grape or you drink your cherry. So they tell you either have to submit to the federal exchange and fall into the federal exchange, or we'll let you set up your own exchange. Okay, to me, either one of those is a zero answer. It is a non-starter. They both significantly inhibit people's individual liberty. The other option is that under the Roberts ruling in the Supreme Court decision, and nobody read the ruling. They listened to all the pundits and whatnot. So I sat down with a very well-versed attorney, and he went through the ruling with me, and it's very revealing the way Roberts wrote it. And one of the provisions in there with regard to the federal government imposing on the state the requirement to spend money. And that decision, Roberts clearly states the federal government cannot force states to spend local tax dollars in support of the federal health care law. And under that premise, we didn't have to expand Medicaid if we didn't want to expand Medicaid and other aspects of the law. Well, I would submit that reading that, it also means that we don't have to do the exchanges if we don't want to, because it will cost the states money to do the exchanges, and therefore the federal government cannot mandate us to spend money. So option 3 is the none of the above option, which is the option I like. We have a state Department of Insurance that manages the insurance companies in this state and grants somewhat significant more freedom. I wish we could deregulate it, of course, as you know, much more, and allow for interstate sale of insurance policies, which I think is a great way to increase competition, which is also what the founders loved about the free market in this country.
And that's what we in AAPS and other medical organizations have been supporting as well as a way to lower cost.
Yeah, the most powerful force in the universe is the consumer. And if you empower the consumer, you will watch, the best mechanism to deliver any product is determined through consumerism. And if you make a very expensive tire that goes flat all the time and you don't force people to buy it, people won't buy it. They'll go find an inexpensive tire that doesn't go flat. Well, the healthcare law, some might say, is that very expensive tire. We don't know if it's going to go flat yet. I have a funny feeling it's going to, but the reality is if people have a choice, they may or may not choose that particular route. And I think giving them the choice over their own medical care, and that's what people don't, this isn't necessarily about your access to care. This is about the quality of care you're going to receive. I mean, what good is it having access to care if it takes you 3 months to get access, and that access is subpar because many of the quality physicians have decided to leave the system, or it has been rationed because the resources aren't available to provide that high level of care that many of us are used to getting when we walk and see our doctor.
Well, and many studies have, and polls nationally over the last 3 years have indicated that anywhere from 45 to 60% of physicians across this country are planning to leave or leave medicine or change careers or retire if the 2010 healthcare law isn't repealed, because there are so many restrictions on what a physician can do. We have to share records with the government. Yep. We have to follow treatment plans dictated by the Independent Payment Advisory Board. This is just staggering. And people are focused on free health insurance and don't realize what good does the insurance policy do you if you can't get to a doctor, or if the emergency rooms are jammed up with days of waits like they have in Canada. So I think that's a real serious issue. Coming back to Arizona, one of the concerns about the exchanges is that there will be fewer insurance companies allowed to be present in the state. We already have limited options compared to other states. Would you comment on that?
Well, what the exchange, under the federal law, you have to meet certain coverage requirements. Your insurance company has to provide certain coverage, and whether it's for breast cancer screenings, colon cancer screenings, prostate. I mean, there's a plethora of requirements that are required in order to gain access to the exchange. The large, huge companies in Arizona, such as Blue Cross and Blue Shield, Aetna, Aflac, those big companies, will probably have the ability to enter the exchange. The smaller companies that have more of a tailored medical policy may or won't be able to gain access to the exchange. So what that does is it basically eliminates a lot of competition and creates a monopoly, which is contrary to what many people, we don't like monopolies. We used to have the railroad monopoly and the trusts. We had, Teddy Roosevelt was known as the trust buster because people didn't like one or two people controlling everything. But that's what this exchange would do. It would force the insurance companies that offer these tailored packages out of business and allow those bigger companies who've been lobbying many at the federal level for certain provisions.
Well, and lobbying at the state level, too.
Sure, to give them an advantage over these smaller companies.
And patients out there have no idea that all of this lobbying is going on. Number one, patients don't realize that these insurance exchanges are actually going to limit the number of policies that they can choose among, and it provides required coverage. I mean, why should I, as a menopausal woman, have to buy fertility coverage
or prostate cancer coverage? Right.
Well, right.
So it's really sad because and there is a worry that some insurance companies, for example, that provide health savings account high deductible, high risk insurance, because they only cover catastrophic coverage, they don't meet all the other requirements, they may go out of business. So if you have an HSA or an FSA, something that I have, and I really enjoy using.
Well, I have one too.
It's a great liberating experience to walk into a doctor's office and pay cash. You're empowered because now they don't have to say, well, the insurance company says this, insurance company. You get to say, well, that's what I want. Here's my HSA card. Take it out of my account. And Medicare supplement insurance is also potentially at risk. And people have to understand if you're on Medicare and you have Medicare supplement insurance and it doesn't meet all the requirements under the health insurance requirements for entrance in the exchange, that company that gives you your Medicare supplement insurance could also go out of business.
You know, that's a very serious issue. And what I'd like to do is really think about having you come back and let us talk both as the physician and the legislator paramedic with your medical background. What are some options that we can encourage people to push for in Arizona that will help to keep the power in the hands of the patients to make their decisions, to live their lives, to spend their own money? Right now, people don't realize that it is illegal for a doctor who is contracted with Medicare to let the patient pay cash for something that Medicare doesn't cover. And I don't think people realize that because they haven't had some of the cutbacks that we're facing as more and more of the $716 billion being cut from Medicare begins to affect people. People are going to wonder, well, why can't I pay cash for this?
Yeah, and again, if you decide that it is in your best interest to do something for yourself or for your family, I mean, that's what this country is based on, the pursuit of happiness. And by not being able to do that, I think is a fundamental flaw in this federal health care law and current policy, actually. So we in Arizona have tried to say, look, there's something sacred between the patient-doctor relationship. You go in and you trust your physician. You say, I believe my doctor is looking out, and they most 99% do, for the best interests of their patients because of the Hippocratic Oath. But when that doctor has to turn around and pick up the phone and ask some bureaucrat who has no accountability to you as a patient, a yes or a no answer. Can I give Mr. Smith this particular medication? And some guy 2,000 miles away in Washington, D.C. is going to say, well, no, Mr. Smith is of a certain age that we don't think he would benefit. Economically, it has no benefit for the country, or economically has no benefit to him. So we're going to withhold that, and we're not going to say it's not worth spending the money on Mr. Smith. People don't realize that is some of the decisions. Insurance companies make those decisions too.
But there's appeal.
Right, but doctors have the right to make the case that there's an exception to be granted. In many cases, they can or won't or will grant the exception. But under the federal law, there is none. So if the doctor's told you can't give Mr. Smith the medicine, that's it.
That's right. And then, so there's no appeal to the Independent Payment Advisory Board. They don't answer to Congress. They don't answer to the judiciary. So people across this country are losing the most powerful liberty of all, the liberty to live and to be able to have the treatment that they need to sustain life. And I think that as we look at the criteria being moved into whether you're too old, too fat, or smoke too much, or drink too much alcohol to be worth spending the healthcare dollars on, people are going to start to realize, whoa, I exchanged my freedom for government control, and now my life is at stake.
Absolutely. And you're watching people in Canada now wake up to that realization, and many are saying, boy, did we mess up giving the government that much power. Canada
is actually moving towards more private options than they've ever had before because the government-run system is failing. And I think that's something that Americans need to pay attention to. Encourage our listeners to watch the documentary Sick and Sicker, which is on the website www.aapsonline.org. And as we begin to bring some concluding statements today, I want to just say, is there anything else that you'd like to say to the citizens of Arizona about preserving liberty? Well, they need to stay politically active and aware and be informed. Get that information from multiple sources. Don't rely on one source like the newspaper. Go online, get information. Talk to your doctor. Talk to your elected officials, your members of the legislature, and of course your congressional delegation that represent you. Let them know where you stand. That's what representative government is all about. So if you don't speak up, much like those commercials, like when you walk in your doctor's office, they ask you, are there any questions? And the patient sits there, no. They're afraid to ask, but you've got to ask those questions. Get involved.
get the information, and make sure you let your elected officials know where you stand.
Absolutely. And I want to thank you for taking your time on Sunday morning to be here. I'd like to have you back. I'd like to talk some more about Medicare and what's happening in Arizona with the exchanges that can also affect people's choices for their Medicare.
Anytime,
backup.
Doc. Just let me know.
Well, as you have gathered, health insurance exchanges may sound benign, but in reality, you are exchanging your freedom for more government control. This is yet another way that government, state or federal, will be controlling your decisions about what medical care you're allowed to have under these plans, and you will be told what kind of coverage you have to buy, whether it's something you need or not. The end result will be an insurance monopoly with just a few companies being all that are allowed, and your choices more limited than ever. Your policies skyrocketing in cost to cover all of these mandated coverages that you may or may not need. The United States of America has been the greatest success for liberty, a just society, and religious tolerance and economic freedom that the world has ever seen. We can return to our core fabric of America and our founders' belief in individual life and their vision for free men and women able to control their own destiny, including our freedom to make our medical decisions free of interference by government. That is guaranteed under the Arizona State Constitution, and it is also guaranteed in our U.S. Constitution, the right to life, liberty, and the pursuit of happiness, which means the pursuit of living our lives the way we determine. But as I have pointed out in earlier shows, our core values that make up the fabric of America are being torn asunder by the progressives in power who focus on the collective good, the focus on society, larger goals decided by political elites, not individuals. This is an approach that is diametrically opposite the emphasis on the individual that our founders envisioned and set up our Constitution to protect. And people like Senator Frank Antinori have been willing to die to defend our right to live as free men and women. Each of us must now engage in the fight to preserve our economic freedom, our medical freedom, our religious freedom, and the ability to live our conscience and to determine our own destiny. 2012 marks a watershed time in our country's history. We have a major choice. We have major decisions facing us. Are you going to be asleep at the wheel and let things go where they will? Or will you wake up and will you help preserve our founders' vision that creates and gives us the foundation for the fabric of America? Or will you let the United States of America become another social democracy bankrupting future generations? This is Dr. Valit signing off for today. For more on healthcare reform, go to www.aapsonline.org or www.herplace.com. Next time, I'll discuss more ideas on how the American tradition of economic freedom points the way to true reform in healthcare.
You've been listening to America's Fabric, a radio series on American history and culture, broadcast every Sunday over KVOI Tucson and its affiliates. Be sure to tune in again next Sunday morning at 8. Until then, never forget, it's the courage, knowledge, hard work, and respect for truth of Americans that keeps America free and prosperous. America's Fabric is listener supported. To make a contribution, send a check to America's Fabric, Post Office Box 17356, Tucson, Arizona, 85731. That's P.O. Box 17356, Tucson, 85731. All contributions are tax exempt, and every contributor will be mailed a Grateful to be an American bumper sticker. To get more information on America's Fabric or to listen to previous broadcasts, go to americasfabric.com. That's americasfabric.com.